The problem is you do see a lot of antisocial people succeed. Loneliness is as big a risk factor for ill health and death.
We live inside our heads.
You go cold turkey, you go into withdrawal.
There is a lot of value in the stuff that we struggle with.
Better Thinking. Conversations with experts exploring all things psychology. Welcome back to Better Thinking. My name's Nesh Nikolic, and my guest today is Professor Jill Newby, who is NHMRC Emerging Leader and Clinical Psychologist at the Black Dog Institute and UNSW. Jill is a leading expert on the technology-based treatment of depression, anxiety, and chronic health conditions in adults, and leads a program of research into mental health, smartphone apps, and virtual reality interventions. Her research aims to improve the lives of people living with depression and anxiety and those at risk through developing new and improved treatments focusing on holistic approaches to mental health care and improving access to affordable, effective treatment. Really enjoyed this conversation today with Jill. Her perspective on some of the challenges with technology-based interventions is really interesting to listen to, in particular, some apps that she's working on at the moment, and also looking at how AI might be integrated into future interventions. Hope you enjoy the show. Jill, a big thank you for coming onto the program today. I'm really excited to be talking to you as a fellow psychologist, but also someone who's very interested in technology and how interventions have been based in technology to look after or to explore things like depression and anxiety. I think this is such a huge environment that needs lots of resources and attention, and hence lovely to be speaking with you two today.
Yeah, it's great to be speaking with you too, and thanks so much for the invitation to be on this podcast.
Can you tell me a little bit about how you got into this space before we look at what the latest looks like?
Yeah, sure. So when I first graduated from my PhD and master's training in clinical psychology, my first job was at the anxiety disorders clinic at St. Vincent's Hospital in Sydney. And there they ran both a face-to-face therapy clinic where they primarily delivered CBT and or pharmacotherapies for clients with anxiety disorders, but they also ran an online clinic called CrewFag Clinic back in the day, and now it's called This Way Up. So I really got interested in online treatments at that stage because it's kind of just part of my role. Every client that came through the anxiety disorders clinic would be offered an online program that was done with clinician support. And the more and more I used them in my practice, I just saw them working. I saw people's symptoms improving. I saw them being empowered to self-manage their mental health, which is what we kind of aim to do in therapy, and getting the skills and tools that they needed to help manage their anxiety and or depression if they experience that too. So I got really excited and interested in it from that first job.
Fantastic. And I believe it was a long time ago now, received some emails about This Way Up and referred actually quite a number of clients
that's good.
to This Way Up. So that's a lovely surprise. I haven't used it for some time. Is it still running?
Still running, yeah. So it has two different models. You can do a self-guided program where anyone from the community can kind of sign up themselves and take themselves through one of the online programs. And it's also got a clinician-guided program. So that's where any clinician from the community can register as a clinician on This Way Up, and then they can prescribe a program and monitor their patients through that program.
Fantastic.
So yeah, it's still in existence and still being used and working well.
I know this sounds a little bit naive, but what's the advantage of having an online program versus just going out and seeing a psychologist one-on-one?
There's different advantages of both. In a face-to-face therapy, you get that human connection. You can get a really strong therapy alliance. You get a person that is highly skilled and be able to kind of address the problems that you're bringing to therapy. But on the other hand, a digital program is immediately accessible. There's no wait. You can access it any time of the day or night. you can teach yourself how to manage your symptoms through very evidence-based information and techniques. And it's usually costs a lot less than face-to-face therapy. Each therapy session, if you're getting a Medicare rebated therapeutic intervention, each session can cost $60 to $100 each session out of pocket, above and beyond what Medicare rebates. And an online program is either usually free or low cost. It might cost that for a whole 12-week program. So there's some really important benefits that are really important to people in the community.
It's also something you can reference, you can go back to, you can repeat and reinforce. I think there's something to be said about having that material available to you to do some repetition or review, which I think is a big plus in having something written down that's consistent as well, consistent messaging, but also evidence-based.
Yeah, it is. And I think that's one of the huge benefits. And one of the things we don't always pay attention to in face-to-face therapy, a face-to-face therapy session can be very daunting. An hour-long session, you might talk about a range of different topics, a range of different skills, learn a whole bunch of new kind of concepts in a very highly stressful environment for some people. And you might forget most of what you talk about. So either you could record the session and listen to it on playback afterwards, or write some notes during the session. But often people just forget what you've talked about in that therapy session. And an online program, like you said, you can go back to. You can download the resources and techniques to have kind of as a lifelong program that you can revisit if you're experiencing a lapse or a relapse in future. And it's better for memory because you can go back through the content on repeat to learn, to practice, and to learn again. And you might just see different things in reading the material each time. So I think it is very beneficial in that way.
And what are the main models that you've seen have been available to, whether it's clinicians or clients themselves? Are they usually website-based? Are they app-based now more so? Are they videos, programs that are downloadable? What have you found has been the most accessible or widely used at the moment?
They're all of the above. So what's widely used isn't necessarily what's been shown to work in practice. So a lot of the earlier research was on like linear online websites. So you would do a module, complete that module, then probably a week later you would do a next module, and so on and so on. So you the content is structured and graded in what you would have in a manualized-based therapy. So you'd start with psychoeducation, then move on to probably cognitive therapy or behavioral therapy skills, and then so on and so on until you get to the end, which would be focused on relapse prevention. So a lot of the earlier programs were that web-based content. Even earlier than that was CD-ROM, if anyone can even remember what a CD is. That went to
it's
the web.
Scary. I'm like, yep, definitely.
Yeah. Me too. I also just bought a CD and I'm like, why did I even buy a CD? I have nothing to play it with anymore. Not for an online therapy, but yeah, they're still selling CDs even if there's no way to play them. So started with that, but then more recently it's turned to more app-based interventions. And part of that is because the accessibility, you have the intervention in your pocket that you can access anytime, any day of night. And we've done some research in asking consumers or people with anxiety and depression what they would want out of an intervention if they were to kind of start from scratch and developing a whole new program. And most of them said they wanted an app rather than an online program. So more of the research has been done on the online website style programs, but there are a whole heap of app-based interventions that are available on the app stores. The problem with the app interventions is a lot of the apps that are on the app stores are not evidence-based. They haven't been tested. They've never been evaluated, but they are released to the community, which is a big problem in terms of community perception about what these digital tools should look like. They can say mostly whatever they want. They can say this is CBT, even if it isn't. They can say it's a mindfulness intervention, even if it only provides a couple of meditations. So it's a huge problem in quality around what's provided in the app stores versus what's actually been backed by evidence, shown to be safe and effective in research.
How are people generally navigating this space? Is it kind of you plug it into your phone because it's the most accessible thing? You kind of look at most popular, and if it's
Yeah.
most popular, it must therefore be good, right? Is it that sort of sequence that usually occurs?
Yeah, I think it's a bit of a wild west in the App Store. So it will be based on popularity, probably what has really good ratings, but there's a few things that influence those ratings. So often research is not one of the things that influences a 5-star rating. It's kind of usability, features like how how it looks, how pleasant it is, how easy to use it is, whether it's easy to navigate and things like that. I'm just about to cough.
No, you're right. It's quite a challenge because I can see that there could be absolutely great programs that can be evidence-based. They can tap into a CBT type model, whether it's, classic CBT, ACT type of approach, even borrowing from other types of therapy. And even if they are very much linear in nature, where they could be tested so that we can go out and get a strong evidence base, I can just see how alluring it is to have something that is elegant, that is shiny, that works well, and that might not necessarily be reviewed or considered from an efficacy point of view. But the great importance, is kind of lost there because of the need for humans to be, engaged well, and it takes a lot of resources to make something very engaging, especially these days where it's hard to compete with big companies that do an exceptional job, I must say, with many apps.
Yeah, you're right, and you're kind of competing with things like Instagram or Facebook or a bunch of different news outlets where they have a heap of resources that are committed to improving the usability and the functionality.
I'll let you cough. I was coughing a moment ago, having my own struggles. But you are right, because the moment we are on a device that is also linked up to all of these other interesting web programs, apps, so on, we're also competing for time. We're competing for attention, and whether we like it or not, yes, our mental health is important, but I can certainly see how, for the younger generation in particular, TikTok's going to be much more appealing, or Instagram, or whatever it might be. And these days, so much mental health information is being shared in these little bite-sized, interesting, funny, or emotionally charged ways that's compelling for younger people in particular.
Yeah, it is, and it's in a format that they want to consume, I guess, and it's interesting and engaging. And I guess when you're competing with that, with a what can be a bit boring, but also very challenging kind of therapy, behavior change is really challenging. It's really can be both empowering but very difficult for people to engage in. So yeah, it is a bit of a challenge for, I guess, developers of online and digital kind of programs that are meant to be therapeutic. But it's also kind of calls also for the importance of regulating the content that is provided on Instagram and TikTok and other systems like that, and YouTube, because anyone can make content around mental health, and it may or may not be accurate, may or may not be good quality, and it might not be right or the best thing for the person that's watching it. So yeah, I think there's a lot of challenges around technology and mental health literacy and the information that's provided by people who are non-experts. It's a bit scary in some cases.
It is, and it maybe even poses a question of why aren't we, as a profession, doing a better job? How do we get that message out there? But it's hard because our profession doesn't like bite size, because it's not context based.
Yeah.
The efficacy comes from understanding the context, not from a quick bite size, or because it ends up trivializing someone's mental health. If we just go out and say, oh, here's a breathing technique. It's so important to discuss whether we're using breathing as something to downregulate versus an avoidance strategy. And we know that if it's an avoidance strategy, it can actually be counterproductive versus, a regulation or opening up to an uncomfortable feeling. Some psycho ed around it as well as to why it works, releasing the buildup of carbon dioxide and so on, which might make it a bit more sticky for a client to actually adopt versus a quick, I don't even know how long TikTok allows you to chat. Not on that platform, but I've heard it's quite narrow and short. And if you haven't grabbed someone's attention quickly, they're going to swipe to the next video.
Yeah, but that's also right. I think clinicians, by pretty good reason, are quite conservative about what we do, because I guess we've seen the risks and the problems that can happen if a therapy is done badly. And we're very cautious, I think, as a profession to make sure that our clients are safe and supported and their mental health is protected. And even an example like that, a breathing strategy can be incredibly beneficial depending on the client, but also sometimes breathing techniques can be very anxiety provoking for some clients, especially people with panic. When you hyper focus on your breathing, even though it's meant to be a good thing, that can escalate your anxiety because you are so focused on your breathing, and then people can get anxious about the fact that they're not managing their anxiety and they're not breathing properly, and then that hyper focus can actually escalate it. So, as clinicians, we can see that, and we want to be conservative and make sure that we're using the techniques in the right way. And a TikTok can't do that.
Absolutely. What are some of the apps or platforms that you could point to that are really good resources that have had some more vigorous assessment or research into their efficacy? Are there any that stand out for you?
Yeah, so where I tend to send clinicians is a place called eMental Health in Practice. Sorry, so emhprac.org.au. So it's kind of a coalition of a few different organisations, including Black Dog Institute. It's got a really up-to-date guide of evidence-based digital programs split by the type of concern that a person has. So say, for example, it's a child with anxiety, then you can look for children with anxiety and look at what programs are available. If it's for adults, if it's particularly a particular cohort of adults, you can look through that list and see which ones are supported by the federal government. So in order to be supported by the federal government through funding, they need to have a base level of digital mental health quality standards, accreditation. So you can be a bit more confident that those programs are being tried and tested and are research backed. The go-to programs that I tend to use if I was like working clinically and also still doing research at the moment, I would probably refer people to This Way Up just because I'm really familiar with them. And I refer people to MindSpot as well, which is another great set of programs that you can do under the guidance of a clinician. So they're two kind of services that I would recommend. There's other programs on apps, depending what you're looking for. So, Headspace is really good for mindfulness, and it's very engaging and looks really nice as well. It's got that really good look and feel. We've been developing a new app-based intervention, which isn't released to the general public yet, but it will be at some stage, and that's called My New Way. So that's trying to get kind of the latest evidence-based techniques into an app form that people can use alongside their therapy, hopefully eventually as a standalone program as well.
What's some of the challenges in developing something like that? I'd love to hear about what happens in the background in developing it, designing it, all your considerations, challenges.
Oh, there's heaps of challenges, I think, in developing an app. I've realised I've learned a lot over the last few years in developing different apps. So the big one is cost. It's really expensive to develop a high quality app that protects clients' data. and that looks really good and is easy to use. You could probably develop a quite clunky one for a lot cheaper, but given people's standards are so high for the kind of digital apps that they're using, it's just expensive to do that. So that's the one thing. The second thing is around, trying to help everyone. So, the cohort of people with anxiety and depression is quite large. If you're looking from 18 and above, that's a huge amount of individuals in Australia that all have different needs and diverse concerns, very specific issues or problems that you might want to help them with, and also a range of different CBT techniques that could be helpful. And not just CBT, there's a range of different therapies you could potentially put in an app. So I think the design of a program is really challenging to be able to meet as many needs as possible, whilst also not being so specific that it's just tailored for one group. So one thing that's been really great is working with the user experience and user interface team at Black Dog. They're really great in thinking about how you use the design to meet a person's needs. And they're really excellent at I guess design features of an app, how it looks, how it feels, the kind of buttons that you use, the kind of way you interact with the app to get where you need to as quick as possible. And so that's been really useful, having other expertise, because we don't have that expertise. We've got the clinical expertise, but it's not the same as being able to distill that down into something that is engaging and easy to use and functional, that is also possible to be developed by developers, because that's the other side of things. It needs to be practical and doable without costing millions of dollars. Yeah.
There's such a hard balance, because I can see the importance of iterations, trying to publish something, put it out there, thinking that this is how it might be used, or this is how it would be most user-friendly. But then, when it goes live, being able to take feedback and making amendments and changes, the costs must be exorbitant.
And I think the grant system that we have at the moment for mental health doesn't pay for development. Normally, grants are provided to support research trials or research studies, and it also doesn't support post-trial feedback. So say, for example, you've done a huge clinical trial to test out some particular digital intervention. The feedback is really valuable. You've learned 10 different ways you could improve this before you disseminate it to the community. Funders don't give you money for that, because it's kind of a boring sell. Oh, let's improve this thing a bit before you release it to the public. It's just not funded. And I think that's really sad, because of all the investment that's probably gone into that digital app or intervention. Just being able to take it from one point to improve it a little bit could make all the difference for many thousands or tens of thousands of clients that will end up using it. So that's, I guess, another challenge, is being able to get the funding and keep the funding up to be able to maintain an app and update it, and so it can be the best possible based on the feedback that you're getting from real world users.
And that's such a good point, because every app that's been incredibly successful has had a requirement to iterate and to change over time. And what it started with versus what it's ended with has often been very different. But we also know that psychologists are much the same. We have to keep iterating our own clinical practice. This is why we've got a lot of professional development and learning and trying to be curious and reflective practice and so on, is so that what I'm doing today isn't the same as what I was doing yesterday, and I can at least query and develop on how I'm practicing today. And sure, I might make some errors today that I didn't yesterday, but that's still part of the iteration, to go out and say, okay, I'm learning these patterns of what not to do or what to do, so that over thousands of iterations over a year or two, I'm a better psychologist, so to speak, in terms of I'm meeting my clients' needs, or I'm formulating better, or I'm being a little bit more reflective in challenging case formulations and the like. But we don't do that with an app. That's really fascinating. That's so
But I
fascinating.
think that's the new frontier in app and digital development is around using data to inform some of that. So being able to use advances in AI to be able to test and iterate and improve the kind of information that's been recommended to certain clients with different problems or different goals or different needs. I think that's the next frontier that's going to be worked upon and improve the way that we can deliver tailored and personalized interventions in a digital format. And that's quite exciting, also daunting, but an exciting new space of research that's to be conducted.
I've got to ask you about your views about AI and where you think that might be going. I love watching the advancement of technology. It blows my mind every day. Last night I watched Elon Musk's SpaceX shoot a rocket in the air and then get, the booster comes back down from almost close to space, comes back down and it's caught by what they've dubbed chopsticks, which is these two little protruding arms that catch the rocket coming down from space. Absolutely mind-boggling to observe and to watch. I'm blown away by ChatGPT and what it can do. And I've tested it. I've asked it really what I think are nuanced questions within ACT that really explores the difference between avoidance and leaning in, making space for it, and it nails it. It absolutely gets it right. And I know that
it's surprising.
I've known that clinicians have struggled with this, and so it's phenomenal that it has a high level of intelligence already, or at least predictive capability to come up with a clinically sound response. Where do you see AI moving, and any of your thoughts? Areas of optimism, areas of concern or fear. I'd love to hear your point of view.
Yeah, I think it's such a big area, isn't it? And I'm by no means an expert. I'm trying to learn more about it and how it can be used. I think the reality is people are already using it in their practice. So anecdotally, we hear of people using AI tools to support their administrative tasks. So ChatGPT has been used to write discharge letters, even develop treatment plans, ask clinical questions, even develop, tailored psychoeducation handouts for their clients based on a particular client's interests or goals or needs. So it's actually already been used. And I think I'm really interested in learning more about what clinicians are using it for, how it helps, what the drawbacks are and what their concerns are, so that we can kind of help them with training or supervision or guidelines or things that can help their practice. Because I think it is an amazing tool that we just are not capitalizing on enough, probably. The areas which I'm excited about in AI, so obviously there's some drawbacks, the data that trains the models, that's really important, but we know that in research often don't have very diverse samples, often very white, educated backgrounds. That doesn't necessarily generalize to more diverse backgrounds. And so we've got to really be keeping in mind some of these limitations of what data was used to train these AI models. But the things that I'm excited about are around tailoring interventions and also tailoring treatment recommendations. So in terms of the tailoring interventions, the work, we have just started a Centre of Research Excellence on this in depression treatment precision to look at how we can use AI to get better, more precise and personalised treatments for depression. And one of the questions we'll be asking is, within the therapy, can we use AI to determine what treatment component might work best for an individual? So, with a psychological therapy like CBT or even ACT, you have a range of different techniques. You might, with CBT, you might have exposure therapy, behavioral activation or activity planning, different cognitive therapy techniques, more acceptance style techniques. goal setting, problem solving, ruminative thinking strategies, all those sorts of things, but we don't actually have really good evidence about which one we should try first and next, depending on a client's profile. So I think AI could be really beneficial in using data to inform what therapeutic components could be most helpful for a given person at the time that they're experiencing that distress, and what might give them the most bang for their buck and being more efficient with the therapies that we deliver. But the other side of it is we've actually already done some work here at Black Dog with our collaborators at Macquarie Uni and the Applied Artificial Intelligence Institute at Deakin University. So we've been working on a trial for the past few years on how you can use a new AI clinical trial method to decide which intervention might work best out of a given few different possibilities for a different client. So in that trial, we tested a few very brief interventions for university students. So one was sleep intervention, another physical activity, another mindfulness, and then like a mood monitoring ecological momentary assessment control. And we're just really interested in, can we use AI to figure out what might work best for a given young person who is distressed out of those set of possible treatments. It's the first time this AI method had been used in a clinical trial. And what was really interesting is it showed different outcomes to what clinicians thought would work. So the clinicians we surveyed thought that mindfulness would work the best, whether or not a student had mild distress, moderate distress, or severe distress. Whereas actually the AI technique showed that mindfulness, physical activity, and sleep perform differently depending on how severe a student's distress was. And I think that's a really interesting display of how AI and the data informed decision is very different to what a clinician's decision might be. And I think that's a really exciting area because it's potentially going to help different treatment recommendations for a given individual. And when you've got a whole select set of interventions that you could provide an individual, you might have ACT, behavioral activation, a mindfulness therapy, interpersonal therapy, or even a physical activity intervention. Which one should you choose for that client? I think that's where AI can come in to figure out what might work best for that individual based on their preference, but also their personal profiles.
And what was some of the AI data? Sorry, what were some of the data points that the AI was using for those cases to predict which intervention might be better than another?
Yeah, so because it was the first time anyone had done this in the world, we only used distress as the main example. So just psychological distress on the depression, anxiety, stress scale, kind of a normalized distress severity score. We needed to start somewhere, and that's the variable we chose. The next trials that we'll be doing will be looking at a range of different, I guess, data inputs or data variables that can go into an algorithm that can probably tailor recommendations. And that's where we would bring in, could be demographics, but also patient preference, past experience, chronicity of their mental health issues, past experience of successful treatments, and then combinations of treatments. So there'll be a range of different variables that will probably go into that algorithm rather than just a simple one. But we started simple and got some good evidence that this has potential to go to the next step in a bigger trial.
It's so fascinating because I've always thought about what is it that makes one clinician possibly superior to another clinician. Not that we necessarily go out and test one against another, but anecdotally, there are some clinicians that I think do an exceptional job. That they stand out from many great psychologists. Some seem to, at least from my clinic, they just get fantastic reviews and responses that we kind of check in with our clients from time to time. It's not scientific by any stretch of the imagination, but I've always wondered what is it that we are doing, and it almost seems like we're on the cusp of a 10-year cycle where AI can be integrated potentially heavily into our work to either notify us about how, where we might lead with our next intervention or questioning, or at least give us some clues, so to speak, because we're kind of doing that already ourselves. I know in my mind, I'm sometimes letting some things go, even though they're quite interesting and important. I might let them pass and take a different lead. Well, I think we're doing that constantly. But to be able to potentially have something observing the language of the client or having the history of the client, looking for some reference points that I can't observe, particularly, some new things. It could be some visual cues as well that you and I sometimes pick up on, but AI would be far superior in that sense as well. So I think there's an exciting space potentially to either help us with where we go, or even potentially make us better clinicians in terms of coaching us in how delivery might sit well for an individual. That every client, I mean, we're trying to do that anyway. I always say I'm a bit of a chameleon. Depends on who's in the room, is how I change my language set and how I approach the client and so on. But in some sense, it is a bit of a guessing game. There isn't a feedback loop or a data set in my brain that I can go out and say, I know this is valid, and that this has got a higher probability of working.
Yeah, and I think some of that data can be really probably useful to identify patterns in the data on people who might disengage from treatment as well. I think we have a real problem in psychological therapies in general, and even medication-based therapies, of partial dose. So if someone only attends for a few sessions, they might have some symptom improvement, but that if you're not fully recovered by the end of treatment, you're at risk of relapse. And you might, if you've disengaged for whatever reason that might not be obvious to the clinician, but might be able to be picked up with, accumulating data from a bunch of different clinics and different clinicians that might tell the clinician ahead of time, this client might be at risk of dropout or disengagement. Here's, at least pay attention to this. Here's what we might recommend. That could be really useful too, to help a client stay engaged, prevent them from dropping out, going through that revolving door of therapy where they might try one clinician and another clinician and another, and then have this kind of partial response and then just get demoralized because they feel like it's not working. And I think that's another area that could be really useful, using these data and the insights to help detect non-response through disengagement rather than the therapy not working.
Can you see the possibility of psychologists using, in a similar way, how the This Way Up program has been used as clinician-led version, or guided, my apologies, to maybe also having an AI system that can assist a client? It might be, for example, doing some exposure work, and they can be, the AI assistant could be encouraging the client in a certain exposure, that can be done in real time. I think one of the most amazing things that I've done as a clinician has been when I've been able to go out, into the real world, so to speak, and do some practice in the wild, in live, side by side with a client. Obviously, it's not easily produced from a practical sense, but the power is phenomenal. Do you see a world where maybe AI can assist in that way?
I do. I mean, I think it could be incredibly useful, and also providing a tool to use between sessions. I think clinicians are very cautious, and so it would take a long time for them to be convinced that this kind of tool or software or technology is useful. So they'll probably be the slowest to uptake a technology like that, if I'm to be honest. I think clients would, or not clients, but people in the community who are suffering from anxiety or depression or another mental health issue, will be looking towards innovations like that they can access in their own time, in their own home, or outside of session, to be able to get better quicker. And people are already turning to things like ChatGPT for mental health support. I know I've heard anecdotally, and I don't know the research too well on this, but people are using ChatGPT to ask it for mental health advice, education, techniques, and support. So they're already turning to this because it's so hard to get face-to-face therapy in the community. There's just such a long wait list and so many barriers to seeking specialist support. So I see the people in the community taking up a technological innovation much quicker than clinicians might use it in their practice.
I've certainly played with it in that sense, where I've asked it to be my psychologist and then sort of role played, and it's surprisingly good.
I think
really surprisingly good.
Yeah, and I think I've done the same thing. I've kind of just been curious about what answers might give, but also asked ChatGPT to explain different psychoeducation concepts, and the language is just excellent, far better than what I could write or develop. I think where it could also be useful, but probably not capitalized enough on yet, is training. Because those answers are really good and usually pretty specialized and have that nuance, I think a trainee clinician could actually benefit probably from practicing different question styles, learning about different ways to explain different concepts, figuring out treatment planning, getting new ideas to tailor different techniques to a different client. Obviously not breaching confidentiality or privacy, but I think it is a really cool training tool that probably hasn't been utilized enough, given that the way that it explains concepts is so clear and engaging, and you can have a variety of options. You could ask, tell me 5 different options of explaining the cognitive model to a client who is 14 years old, male, living with his parents. Or you could say, tell me 5 different options that are targeted at, an older woman, and make sure the examples are appropriate to that kind of client. So it is a really cool tool you could use for those kind of training opportunities.
I think there's so many applications. While you're talking, I was thinking, even for psychologists, one day I'm sure the parameters you'll be able to put into these models will be, for example, based on the APS Code of Ethics, here's my ethical dilemma. How should I think about this? How should I look at it? What are the considerations? And if it can digest a very specific article, and we could then ask it also consider legislative requirements and X code and so on, rather than us going out and calling up the professional advisory service and utilizing them. I'm sure they've got other more important jobs to do as well, although I think that would be quite an interesting job. But I can see the value that a tool like this could have, because some of them are just genuinely always going to fall into a grey area, and that's great. They should fall into a grey area, and then we have to make a clinical decision.
Yeah, and I think it can be a tool that would be useful for that. I think it's really important also to have that additional, as clinicians or psychologists, we have a lot of training in critical thinking as well. We can take that information, say, from ChatGPT and go, does that look right? What would I think of instead? What are the other considerations too? So I think having that background in critical thinking and being able to look at knowledge and figure out, is this the best approach for my situation, and or get extra peer support or other supports, I think it would be a really nice foundation to be able to use with those skills and abilities that we learn in training.
Almost like an aid to us. So, if the information is easily accessible because we've got confidence in the information that the model is providing, I can then lean on it in a comfortable way and then make my own clinical decision. Even if it was done in therapy, the model could say, hey, clinician, think about potentially, inquiring about X. I can still ignore it. I'm still the author of therapy, and so is the client, and there's a conversation occurring, but it can guide me, and I think that can be important because its data points might be a lot greater, and I can still turn it on and off. I can decide, but I can see a real synergy where I can work with it, and then I can still decide. We currently use in our clinic here a AI scribe effectively that helps us with writing clinical notes, and it's fascinating how quickly us as clinicians end up kind of leaning on it so heavily, and there's a danger in that we just follow it so much that we forget to be the author of the notes.
And you're
and I'm not
responsible for those
suggesting,
notes as well, right?
yeah,
Like, you're responsible for the content and making sure they're accurate representations of your session. So,
yeah,
but it's such a great tool to be able to reduce the administrative time that you spend writing a note.
spot on. And I'm not suggesting that's what psychologists do, but I can see the bias for us to want to just lean into it and do exactly that because we get, quote unquote, lazy, right? Path of least resistance. And when something is just so exceptionally good, we can take shortcuts. We've got to be careful not to, surrender our clinical judgment to the machines, so to speak.
Yeah, and I think, as clinicians, our memory for things can be fallible as well, can't it? So if the AI, because it can look quite convincing and accurate, and because it's kind of written in such a authoritative tone, you can believe it. Whereas sometimes it could make mistakes in the content of the session, and you've got to be making sure that you're checking the accuracy of that. Because it could say this client attended with, I don't know, depression, but actually they had bipolar disorder, and it might make that judgment, which was wrong, which has really serious implications if you don't remember that client had bipolar disorder. I mean, that's a really simplistic example, but it could be around any other parts of the content that you might just not remember at the time that might turn critical later down the track when you've completely forgotten about that session.
Spot on. And how we also do our work, how we even remember what's occurred in the session as well. I know that on this particular program, when I use it, I can ask it to do a highly detailed, not transcript, but clinical notes. So it puts in quotes, and it's quite compelling because it'll put in even the way that it's spoken. So it'll put in an or an as we speak. So it's compelling in that it seems like it must be accurate if it's putting that in.
Yeah.
But I can't, for the life of me, remember if that actually occurred or not. So I personally just remove all quotes because I cannot go out and put hand on heart and say, I know it said that, and it'll sometimes pick my words as well. And I'm like, they are my words. That's exactly how I speak, but I don't know if I exactly spoke them and the exact context. I remember saying it, but there's more to it. And so we've got to figure out a way of how do we even do therapy differently. I know for myself, it's kind of changed how I go from session to session because I feel like I'm more present with my client, but I think I'm also losing a little bit of the story, and maybe because the bit of the story was how I was writing it. So I'm having to adopt, and adapt as a clinician to find out how do I use this most effectively so I can do what I really like at doing, which is I can be present. I can really step away from that clinical note-taking side. But I've got to compensate in some way because that was doing something that I've now lost as well. So it's fascinating.
Yeah, it's so fascinating that it has, it has so many advantages, but also drawbacks at the same time, because that process of writing a client note and summarizing what you think the sum up of the session was and what the plan would be for next session, that process in itself probably consolidates the session for you in your memory and also makes you problem solve and actively plan for the next session and think about that client and where to from there. And so interesting how just the way you think about the session would be changed because you're not doing that active sum up at the end or taking notes as you're going along. It probably really helps the rapport because you're probably feeling so much more present than you being typing notes on an iPad or a computer, or even with a workbook, and then the client's concern about what you're writing down there in the notes and all those sorts of things. But yeah, how you can keep that active engagement with the content is really interesting, and how that changes memory and cognition and planning as well. It's fascinating.
Feels like this new frontier is going to really place a lot of questions about not only us as clinicians, but also our clients, what technologies are going to arise. It feels like, some of those web-based, even though they're amazing because they've been, they're clinically sound, they're evidence-based, it almost feels like they're a bit of an artifact already, just thinking into the future. I'm just thinking, gosh, 5-10 year span, which isn't long, is going to change things, and I think change us, particularly also some of our new psychologists. We've got a new psych with us who is an early career psychologist, and I'm thinking, wow, you're not going to be writing many notes compared to someone like Patricia here, who's got 40 years or so, who's been writing notes, and most comprehensive notes of anyone I've ever seen. Worked in a hospital for most of her life, is a phenomenal clinician. But the detail she's put in versus now machine does it with exceptional accuracy. It's incredible. It really is.
Yeah, and I think that's where training programs and research also has a really important role in figuring out where's the next need for those early career clinicians, and also not early career clinicians, in navigating all this technology. And for examples like you talked about with the session notes, how that changes your therapy session and how you adapt. I think we really need to do research to look at how is this impacting practice? What are the issues that clinicians need to be trained in and upskilled in and aware of in their therapy, so they can both maximize the benefits of these tools, but also make sure they're equipped with the knowledge and the skills to be able to navigate these tools too. And early career clinicians will be really important for that, but also just helping other clinicians get on board with the tools and be able to capitalize on it.
And yet the research is so hard to also do, because it's moving at such a fast pace. It's difficult to go and say, what are our data points that we're going to measure that are relevant compared to, what's our base? What's even finding our base is going to be tricky. It takes so much time to figure out what the base is, and that's quickly evaporating as well as more and more of us start.
Because it's so rapidly changing. Yeah, exactly. It's kind of scary.
Oh, wow. What are your hopes for the future? Obviously, you're leaning into this space a whole lot more. How would you like to see technology used in our work, whether it's in from a therapeutic perspective or even in a more general sense?
Yeah, I guess for me, the most important outcomes are making sure our clients have better outcomes, whether it's better and more affordable access to therapy that they can't otherwise get, and just better clinical outcomes, so their lives are improved through whatever treatment they're getting, whether it's a technology-based intervention or a therapeutic intervention. So whatever way technology can be used to enhance that, I think that's what hopefully the future holds. And then on the clinician side of things, it's just making clinicians' lives easier, so they spend more time doing the things that they love and that get the most impact for their clients. So rather than spending time on administratively burdensome tasks that just take so much time, where their time would be better spent thinking about the client and working on different therapies and actually seeing more clients probably for lesser time, that's where I see the potential of this technology, and just making clinicians' lives easier, spending more time doing the fun, important work rather than the boring administrative work.
It's a beautiful way to sum it up, because ultimately I think what you're saying is exactly why we all got into the profession, and we're trying to increase outcomes. We all know that the accessibility is a bit of a problem at the moment. I believe that's not only in Australia but abroad as well. Making sure it's evidence-based, which is one of the most tricky parts for the online space, and making our job more enjoyable, where we can spend more of our cognitive load on our clients rather than, burdensome administrative tasks that don't necessarily aid the client, but are still necessary. And I think it's a nice package that I feel we can be quite optimistic about occurring. I do think it's going to take some regulation and some clever minds to package this, but I can really see this working, particularly if I just talk about this program that we're using. If it's taking notes, and if that data could one day be actually collected across, the world or even just Australia as a data set, it could inform so much practice with that data, and be so useful for us. And
Exactly.
I don't think it's that far away. Certainly in my lifetime, I'm so many future things. You kind of go, oh, we're going to one day get to Mars or whatever. I can't see that happening in my lifetime, but this I can. I can see this happening in my career.
Yeah, I can too. And I think what we can add value is that mental health expertise and knowledge. I think data scientists don't always have that, and being able to make sense of that data and what that tells us about how to improve client outcomes will be really critical. And I think that's where our profession has a really important role to play.
Before I let you go, I know you're incredibly busy. Can I ask you, where can people potentially go to find out more, to continue this conversation, find out more about your work, or the programs that are available that we could potentially start using now?
Yeah, sure. So I would probably start with the Black Dog Institute website. We have a range of different tools and resources available that people can navigate and look through to figure out what is out there. You'll also find some webinars that are developed by MPRAC, which I spoke about earlier in the podcast, and they provide webinars on different topics that are related to clinicians integrating e-health tools in their practice. So that's a really good place to start, because you can hear from people with lived experience and experts who have either developed these tools or use it in their clinical practice, and learn from them about what's worked and what the issues are and how to kind of overcome them and integrating them in their practice. So I'd probably start there, and then that will provide you links on other places to go as well.
Fantastic. Thank you. And one last question. You mentioned that you're currently working on an app. When do you see that potentially being released? Is it a 2024 or 2025?
I hope it's 2025. Yeah, we're applying for funding pretty soon to be able to roll it out or to make it available to the community. We've tested it with certain group of clients and clinicians, so we're hoping to roll it out next year if we can get the funding to be able to do that.
Fantastic. And any early scoop about what it might be called, or
It's called My New Way.
My New Way. Fantastic.
Yeah.
Okay. So we can all start looking, I suppose, periodically. I'm assume be in the App Store, so we can just periodically have a look if it's available. And I'm sure I'll hear from you, as it gets
that's right.
released.
And we'll be letting the clinical community and then general public know as well when that's available to the community. So yeah, you can hear from Black Dog. If you follow Black Dog, that's probably the best way to go, because then you can hear about other technology innovations that are being released also from our research teams and our clinical teams too.
That's part of the other issue of evidence-based, or technology-based interventions that are evidence-based. Part of the issue is, we've got to figure out how we do distribution, and there's so much in marketing that's required. And I think places like Black Dog Institute are phenomenal around that. And, we need that government backing to go out and say, let's go out and advise the public, advise clinicians. You can't do it without, an army of people, and if the good work has been done, then we just got to get into the right hands. So thank you so much for coming onto the show today, and obviously sharing your experience. I'm really looking forward to seeing this new app in real life when it comes out. And appreciate the work that you do and everyone else as well, and Black Dog as well. It's fantastic to have you guys always championing, mental health and in depression in particular. But that whole picture, it's so important that conversation is, around and constantly discussed, because there's plenty of people in need.
Yeah, thank you so much.